Hey guys, my name is Cynthia Veronica and I have two children. I have Samantha, who is now 7 years old, and Sebastian, who is 9 years old. I can't believe it. And Sebastian happens to have achondroplasia, which is the most common form of dwarfism. So in this video, I really just want to talk about one thing that I've encountered lately, which is orthodontic care. So when Sebastian was first born, we were connected with a variety of doctors. We were referred to a geneticist, a pulmonologist for a sleep study, audiologist, an ear, nose, and throat doctor, a neurologist, and I mean the list goes on, an orthopedic. One doctor that was never really on my radar before until we went to the craniofacial clinic more recently was an orthodontist. So the orthodontist that we went to recommended that as part of Sebastian's care that he get a palate expander. And I had never been to an orthodontist before, and I didn't really know what any of this entailed. So it was really interesting when she showed me his first set of x-rays and she said, we need to do some expansion in his jaw area. So in his palate, we need to do some expansion. And there were several reasons for it. The first reason was for dentition. We needed to allow for more room for the teeth to grow in. If he didn't have that, then he would have to have teeth pulled. But the second and more compelling reason for me was because his airways were so narrow. And she showed me his, airways and how narrow things were. And she strongly recommended this palate expansion treatment because this would help not just with dentition, but also with, making his airways, a slightly bit larger. So we went through phase 1 because he will also need phase 2 or another round of expansion. But phase 1 was basically started with the surgery in March of this year, and it consisted of him having his palate expander surgically placed using screws. So he had 2 screws that were placed inside his palate, and this is something that normally isn't done. Usually they just kind of glue it in place, but his specifically, because he needed so much expansion to be done during phase 1, the orthodontist recommended that he have this surgically screwed in. So we went through that. Around August, he started complaining about pain and pressure. And so I went back to the orthodontist and I said, look, I think we need to remove this because he's been complaining for a while now, for about a week, and it's just not going away. It's looking really sore. It's looking like things are really tight up in there. I can see his kind of the skin of his palate kind of, growing over the palate itself. So that was really concerning to me. Because it takes a long time to get into the OR, we didn't get the palate expander. He didn't get the palate expander removed until September. So it was a long time of us just waiting for him to get into the OR. But finally we were able to do it. So he was supposed to have this palate expander in for about a year, but he only had it in for 6 months. Luckily we were done turning it because every day we had to turn it a certain amount. And so, once the palate expander is in initially, you turn it until the doctor tells you not to anymore based on the measurements that they're taking on an ongoing basis. And then after you're done turning it, the palate expander is kind of acting as a cast. So it's in there to kind of hold things in place. And keep it expanded the way it is. We got it removed a little early, so with that we know, but even so we knew we were going to have to go through phase 2. So I wanted to share though with you some of his before and after pictures because they were really compelling. And because an orthodontist is not something that was ever on our radar until more recently, until he was like 8 or 9 years old, I wanted to share this with other parents because you may not know that, you know, with achondroplasia, everything is really constricted and everything is really narrow. You have mid-phase hypoplasia of the, you know, face, and with that, you know, you also have very narrow airways. And so it's just really great to see his before and after pictures. In the videos that I'm about to show you, you'll see that there's more black space. So things aren't just a little bit more whiter, but you can see more black, which means more space for air to flow through. So his airways have definitely gotten a little bit bigger. It's still pretty narrow, but now we're at the point where I just met with the pulmonologist and we're going to evaluate whether or not Sebastian will even need to have a CPAP. One concern that I have with CPAP is, number one, he's not tolerant of it, so he takes it off, you know, very soon after we start, you know, we turn it on and he starts using it. So it's really hard for him to tolerate. But another thing that doctors have told me, including the pulmonologist, is it really constricts growth. So it's kind of counterproductive anyway. So I was really excited when the orthodontist had said to me, let's see, he may or may not need the CPAP. And it'll just depend on, you know, how much more space has opened up in there. Even though it still looks pretty narrow to her, it's, you know, possible that he may not need it. So one thing I will say about this whole journey is that it has been very expensive. We have dental insurance, but we were referred to an orthodontist that was out of network. And because of that, we've paid thousands of dollars out of pocket. This was over $7,000, not including the surgery. That's another $3,800. So in total, even because we're out of network, our insurance isn't covering it. So we're definitely paying tens of thousands of dollars. So it's not cheap. If we had gone in network, it probably would have been significantly cheaper, but I just didn't want to go with just anyone. I wanted to go with an orthodontist that was, you know, that had experience with achondroplasia, that, you know, kind of understood the complications that we're dealing with, or the special, you know, the specialty of what we're dealing with. It's not just your typical child. You're not just putting in your normal expander in the mouth. There's some additional details to consider. And ultimately, even though it was very costly, I am happy with the results so far. I am happy that, you know, his airways are less narrow. Another thing I'll mention is that along with the palate expander, there was also these two little things that stuck out on either end, and that allowed for him to use a headgear. So he would have a headgear and then these rubber bands to help push things forward, because the airway is very narrow, and that's one intervention that doesn't involve surgery that kind of helps to move things a little bit more forward. So the unfortunate thing about that was he was not very tolerant of that. So I would have him put it on at night, and then I guess in the middle of the night he would take it off, because in the morning I would go to his room and see that he would have it off. Or he would try to kind of sneak it back on as I was entering his room, so I would catch him. So, you know, unfortunately, we probably didn't get the full benefit of the headgear. Part of it is also immaturity, his age. He just, if he doesn't tolerate it, he doesn't understand. As much as I try to explain to him, this is something that you need in order to breathe more and breathe better, to increase yours, he still, you know, just didn't tolerate it very much. So that was unfortunate. Of course, you know, talk to your doctors, but if it's not already on your radar to talk to an orthodontist, that's something that you may want to do, or ask your doctor for a referral and see if, you know, for various reasons for dentition, to make room for teeth, and also to help with the less narrowing of the airway, to see if, you know, those complications will be minimized with a palate expander.
So this is before,
That's incredible.
and that's now. You can even see the growth of the hole in that area, even though his airway still looks extremely small to me. His palate is a lot bigger, but let me show you the other section views for you. So this is before, and that's now. So you see how much all right, so this is before and this is now. So you can see all the space around the turbinates of his nose that he didn't have before. So we're looking also at the amount of space there is for his tongue and around his nose. So all that looks really good. Now the question is just, is there enough space for him to not need the CPAP? I really don't know.
I hope this was helpful, and yeah, thank you so much for watching, and I'll catch you in the next video. Bye for now.